Hi, this is Dr. Penn here. I'm an ER veterinarian and wanted to chat today about some things that you can look at home if you have an older dog and you're not sure if they're doing okay today. Some of the things that you can look at home to tell whether or not this is something that they need to come into the emergency clinic urgently or they're just having an off day. One of the first things is checking their gum color. You want to be able to lift up their lips and see that their gums are a nice pink color. It shouldn't be too white. It shouldn't be too light pink, too bright pink. We certainly don't want it to be a brick red color either. So a nice little, I would call it maybe like bubblegum pink, right? That classic pink color. You can also feel their femoral pulses. I'll see if my cat will help us with a demo here in just a moment. He's been a little bit more aloof today. But we'll try to do it all at one fell swoop. So when you go to feel their pulses, you want to just gently find their knee, okay, right? And then essentially very gently slide your hands towards that inside of their leg and then up towards their hip. Does that make sense? So find the knee on the outside, gently slide your hands in so that your hand is essentially cupping over their knee, slide it up, and then you'll be able to feel an indentation on the inside of their upper back leg. And within that indentation, you'll feel their femur bone. That's going to be that big hard bone there. And you'll also be able to feel their femoral pulses as long as they're normal. A medium to larger size dog, that you should be able to feel their pulses pretty easily, just like you would feel your own pulses on your wrist. And realistically, a dog's pulse is going to be stronger than what our wrist pulse is as we're feeling it here. Other things to consider and to look at, you can feel their tummy. We want to check to see if their tummy, number one, feels like it's distended, even slightly, or if it's kind of painful when you push on it. So, and when I say push on it, we want to provide just some very gentle pressure. We don't want to be pushing with a lot of force as it may hurt. Sometimes we can see these babies where they will have a mass that's been growing for a period of time, and one day, for whatever reason, it ruptures. Now, when that happens, or even when that mass is growing, if it's on the spleen or on the liver, that can be very painful. Those encapsulated organs can have a lot of stretch receptors that get activated as this mass is growing, and it can be quite tender. Similarly, if there is fluid in the belly, sometimes that can cause some irritation within the belly, and that in and of itself can lead to inflammation and tenderness or pain associated with some light touching. Let's see if Cashew will let us do a little demo on him. So one of the things that we want to try to do is to gently look at the gums. So very gently, again, we want to just kind of gently lift up those lips and have a look and see what color that gum is. We don't want to put too much pressure as that can be irritating, but it can also blanch out that tissue. Secondary, we'll check our femoral pulses. The way that we find these in animals can be a little bit different, but dogs that have legs, right? So we find their knee. On Cashew, his knee is here, his tummy is here. So we're going to find that knee. We're going to slide our hand up a little bit kind of towards his hip. And then I'm going to put my fingers on the inside of his little leg here. There's an indentation. And then I'm just going to very gently touch just to be able to apply a small amount of pressure there so I can feel that pushback, right? That's what I'm looking for. Again, in a medium to large breed dog, that feeling is going to be much more obvious than it is on my little cat. And it's even going to be more obvious than it is on us if we were to feel our own pulses here on our wrist. So specifically the types of dogs that I'm talking about today are going to be our medium to larger breed dogs, and probably those guys that are north of, 7, 8 years of age. They're laying around, they're feeling kind of punky. They seem like they're tired today, maybe a little bit more than normal, didn't really want to go on their walk, or went on their walk and then just suddenly laid down. Okay, these are those little kiddos that we're going to want to see a little bit sooner into the clinic, particularly and honestly right away into the clinic if their gums seem like they're pale, if their tummy seems like it's distended, or if it's tender or painful when you apply gentle pressure. You go to feel that femoral pulse and it feels very weak, you're having a hard time feeling it, or if it's one of those where it's sort of like kind of like feels like it's flicking you and it feels very abnormal. Other things that you can do, you can actually put your hand directly over their chest where their heart is and see if you can feel their heart. In a normal basis in animals, whether it's a small dog or cat or a larger breed dog, it varies with the placement and how large that beat feels as it's pushing up against your hand, but you should be able to feel their heartbeat. If their heartbeat seems like it's very weak, if it's muffled, so you can kind of feel it, but it feels more of like a dull, gentle thud as opposed to like a strong beat when you have your hand on their chest. Similarly, if you have that feeling and you have very weak pulses and pale to light pink gums, I would bring them in emergently. What I'm worried about when I have this constellation of signs in a medium to large breed older dog is something like a mass that's ruptured within the abdomen, commonly on the spleen or on the liver, that's essentially bleeding. So you have a pet who is effectively bleeding out, but they're bleeding out into a cavity space, right, into that belly. And that is an emergency. And some of the signs, again, can be very subtle. It can seem like it's an older dog who's just having an off day, as opposed to truly what's happening, which is the dog is effectively bleeding out. So if you see those signs, I'd bring them in right away. Something that can have similar signs where they seem kind of tired, they don't want to engage, they either collapse or just lay down on their walk, don't want to go on their walk. Sometimes we can actually see that they have a mass that's been growing quietly, silently, that's sitting at the base of their heart. And one day, for whatever reason, it decides to rupture. And it'll rupture, and it actually bleeds within the pericardial space, which is the sac that surrounds the heart. Now, when that happens, we see some of the same signs, but it's not quite the same. The reason being is that instead of bleeding out and losing a large volume of blood into the abdomen, they're essentially losing a much smaller volume of blood within that pericardial sac. And essentially what happens is that then it reduces the heart's ability to contract and move that blood, push that blood throughout the body. So we'll see that they're lethargic, they're weak. We may see that their gums are pale. Usually their tummy will be non-painful. It will not be distended in most cases, but their heartbeat will feel very muffled. He'll feel kind of reduced, weak, and their pulses will feel very abnormal. They'll feel very, very weak. Sometimes you'll be able to feel it where they kind of feel normal and then it weakens, normal, weakens, but usually in an untrained professional, I would say, they're just gonna feel weaker. So if you have some of these clinical signs going on with your older pup and you're worried, run through this list. If you're finding some of these, I would encourage you to bring them in right away. If you get an evaluation and your pet is otherwise healthy and well, wonderful. Honestly, I'll take cases like that every day. But more often than not, these constellations of signs can indicate that there's something pretty serious going on. So bringing them in right away can be maybe life-saving. So I hope this was helpful. Please reach out, let me know if there's some additional content that you'd like to see. Cashew would be happy to be another demo pet because then that means he gets more treats. All right, everybody take care. Be well. Till next time. Bye-bye.